watching the news. We've all been on social media. We've all seen the internet, and we know the stories and we know the things that are going on in the world. And so I'm not going to have a huge focus on that because I'm sure we're highly aware of the practices that are going on against African American people. I want to show you today what it looks like when you provide culturally competent or culturally sensitive care to children who are African American. So if you have questions and you want to go really deep into racial disparities and biases and discrimination and racism that exists, I'm going to kind of have our focus on what it looks like to provide care, like the right kind of way or the best type of way. I'm going to start here. So something that happened many years ago, about 6 years ago, where I was just like, all right, something has to change. We have to do better for the children that we're serving. I have a colleague who I worked with maybe like 6 or 7 years ago. And she called in panic and she was like, Michelle, I need your advice. I need your advice. I have to tell you something about a child today. And I said, okay, yeah, what's up? What's going on? What can I help you with? And she said, Michelle, this boy, he's 5 and he said he's going to blow up the school. I'm calling the police. And I was like, you're going to call the police on who? And she was like, the child. He said he's going to blow up the school during our therapy session today because he wasn't happy with what was going on. And I was like, you're going to call the police on a 5-year-old child? And I know the child is a young African American boy. And my colleague, she's white. And her first thought was to call the police on a 5-year-old child that she's providing treatment for. I was like, all right, something has got to change. And from that point, I was like, I mean, she went to OT school just like I did. And I was like, if he was a white child, would you threaten to call the police? Would it be different? I said, why wouldn't your first thought be to call his mom, call the school, ask him what's wrong? But her first thought was she was going to call the police. And so we're going to start off from there.